We'll talk about one of the reasons why your health care costs are going up. Coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at the Myrtle Beach Marriott Resort at Grand Dunes. We're focused on Dr. John Molnar, the emergency medical director of the department there at the Grand Strand Regional Medical Center. And we're here. Thank you, John, for coming in.
Oh, happy to be here.
Very exciting. You know, all this week we've been focused on the heart ball, so it's tough for me to break off from the heart ball. And, of course, you're there in the hospital every day recognizing the impact that cardiovascular disease and stroke has on the community, so I'm sure that that's close to your heart as well.
Well, without question, the Heart Ball is a wonderful event, and we support that as well, and it's something that we hope everybody will get out to, because it's just it's been growing amazingly year by year, and it's just it's a fun thing to be. It's a fun thing to be at.
I know it has, and it's get the feel of the lobby this morning, the Marriott. It's just hopping.
Oh, this is the first time I've been here. This is a gorgeous place. It's going to be a beautiful location.
It is. It is.
It's going to be. I think it'll be a fun night.
Should grow quite a bit over the years. It's such a special treat to see this kind of jewel recognized now on the Strand. There's so many amazing hotels up and down the Strand, but to see something like this open up with the infinity pool out there, I don't know if you've gotten a feel of that. You're going to have to check that out.
No, I will have to check it out on my way out.
Absolutely. John, about yourself, do you mind if I call you John?
No, not at all.
Are you originally from the area?
No, actually, I was born and raised in Ohio. Grew up in a town called Youngstown, Ohio, which was between Cleveland and Pittsburgh.
Yes.
Went to college near Columbus, and then went to medical school and residency in Cincinnati. Mm-hmm. And actually moved here in 1988, right after I finished my specialty training in emergency medicine.
Is that right? You've been here a little more than 15 years.
That's correct.
Golly, the whole time at Grand Strand Regional?
The whole time, yeah. I've moved down here right after I finished my specialty training, went to Grand Strand, and have been there ever since.
I saw for a little while, I guess before arriving here, you were in Mullins, South Carolina.
Well, actually, when I first moved to the area, this is in 1988, we staffed both the Grand Strand Hospital, and our group also helped staff Mullins Hospital, so I had privileges there. And still have privileges at the Marion Hospital, because our group also works out there as well. So occasionally, I haven't been out there in a while, but occasionally we'll also work out at the Marion facility.
When you say our group, what do you mean by that? For a viewer who may not be familiar, or in the PD or Southeastern North Carolina, who may not have met you.
Well, I work for Carolina Health Specialists, which was a group of physicians. We started, when I came down in 1988, it was 5 guys staffing the emergency department.
Right.
It has spun off and really become more of a multi-specialty group, encompassing family practitioners and internists, pulmonologists, rheumatologists, endocrinologists. But we also staff several different emergency departments. We staff the emergency department here at Grand Strand. We staff the emergency department. Our group's not the physicians that work at Grand Strand, but the group oversees the emergency department at Brunswick Hospital.
Is that right?
As well as Marion and Walter Brown.
Okay, this is Carolina Health Specialists.
Correct.
That's fascinating. And now, is that pretty common within hospitals around, let's say, the Carolinas, or within the U.S.?
It's not uncommon throughout the U.S. for one group to kind of spin off. There's some economies of scale. There's tremendous costs that go into billing and data collection and whatnot, insurance and things like that can be mitigated to some extent by having a larger number of physicians in the pool.
Right. So if a patient visits a doctor, let's say at Grand Strand Regional here, that doctor is not necessarily an employee of Grand Strand Regional. Or they are.
No, they're not an employee.
Okay.
Of Grand Strand.
Okay.
In fact, we contract with the hospital to provide emergency services for the hospital.
Okay.
And obviously the hospital has a lot of say in how that's done, but we are actually employed by Carolina Health Specialists, and the hospital contracts with the group to provide those emergency services to the hospital.
Are there any hospitals that are actual employees of Grand Strand Regional? Are any doctors themselves, or nurses, or others?
Well, the nurses are employees of the hospital,
Right.
and there are a number of hospitals where the physicians are actually the employees of the hospital. Usually, hospital-based physicians, emergency physicians, or anesthesiologists, radiologists, or pathologists. It would be it's unusual, more unusual for physicians outside of those specialties to be employed by a hospital.
That's fascinating. Wow, John. The difference in Youngstown, Ohio, and Myrtle Beach, do you still get back to Ohio much? Yearnings to be back there?
No, not too often. Occasionally I'll get back to see my parents or my wife's parents. But my parents have now bought a place down here, and they spend about half their time, here in Myrtle Beach. So the desire to get back there isn't real strong. It's the kind of gray winters and cold and kind of rainy and wet. Nothing like you see outside today.
I know. It's so beautiful, and to think we're this close to the heart ball and so many experiences going on. I think Youngstown's known for the former Congressman Trafficant from Youngstown.
That's right.
Pretty popular guy. Yeah, on the House.
Notorious, maybe.
Yeah, notorious. Forgive me. That's right. He was popular enough to get reelected many, many times.
Well, he was very popular there.
Right.
And I think he connected with a lot of people, and it's unfortunate what happened.
I know. John, think about the experiences of arriving here in '88 and seeing not only the medical community grow, but seeing the influx of potential patients grow. You've had a heck of a change in the 15 years you've been here. The hospital's experienced incredible growth. And of course, y'all's practice, Carolina Health Specialist, has grown dramatically.
There's been tremendous growth within the hospital and within the area, and where we've seen it most in the emergency department is in the severity and the acuity of the patients, because with the different facilities springing up around the town, more urgent care centers and things like that, we're seeing much less of the low acuity type patient, the ankle sprain and things like that. We still see some of that, but we're seeing less of that. But our volume is increasing in spite of that, and we're seeing much sicker patients that need a much higher level of care.
Wow, golly. There's so much that's been going on these days. It's fascinating. I think I saw the cover of Newsweek a couple of months ago that had a couple of different doctors on there thinking about it. Is there a big issue right now, I guess, is medical liability reform, and the ideas, or tort reform, the ideas of medical insurance premiums, or insurance premiums have gone through the roof over the last, 10 years or so. What's all that about?
They have, and it's the title of the Newsweek article talking about it was December 15th. If people want to try to look and find it, because it's a very fascinating article. But the title of the article was Lawsuit Hell, and that is really what it's become. It's become lawsuit hell. And for a while, we say over the last 10 years it's been a problem, but it's been up until probably 4 or 5 years ago, it was more of an economic problem, and now it's a patient care problem. Now it's actually to the point where it's hurting patients, and it's the whole system of the medical liability, the way it's structured, is actually now doing more harm than good. It's hurting the very patients it was designed to protect.
How is that? How is it hurting patients, or let's say our average viewer, if they were to go into a hospital for emergency care or special care of any type? How does it affect them?
What's happening is that the current system doesn't really do an adequate job at all of identifying negligence. It doesn't do a good job of protecting patients. It doesn't do a good job of punishing wrongdoers. And so as a result, physicians will alter their practices just to avoid being sued. So what's happening is medical costs are going up dramatically due to a lot of the procedures, probably half the procedures and tests that are ordered for the patient, and another half are ordered just to protect against lawsuits.
Wow.
So there's a lot of unnecessary referrals going on. There's a lot of unnecessary tests and procedures being ordered. But the real way that it's hurting patients is to limiting their access to care. What we're seeing now across the state is that physicians that are involved in high-risk specialties are actually giving up their privileges to perform those specialties. For instance, right here in town, one of our neurosurgeons has recently dropped his intracranial privileges. What that means is that, he's a brain surgeon. He trained his whole life to operate on brains, and he's not doing that anymore. He's operating on spines. He's operating on other less high-risk procedures because his medical malpractice premiums went from, I believe, from about $30,000 a year to about $150,000 a year.
You were kidding.
And he just couldn't afford it. He couldn't afford to do brain surgery anymore. So what that means to a patient is that now, if you don't have coverage for a certain specialty, and we're seeing this in obstetrics, we're seeing it in neurosurgery, we're seeing it in orthopedic surgery, we're seeing it in general surgery. And what it means to a patient that comes into an emergency department, if they need that coverage and that specialist isn't available, they can't get that care. And it's a result of the fact that a lot of these patients are high-risk patients to start with. Somebody that comes in with a brain hemorrhage from a auto accident or whatnot has a very high probability of dying. And these physicians are being sued oftentimes for not preventing that death, even though they did everything possible to try to prevent that death. As a result, the patients are being harmed. The majority of the patients are being harmed because there's a lot more patients that come in that need that care that now can't get that care than the few patients that were harmed by medical negligence that needed to be compensated for that. I don't think that there isn't any doctor that I'm aware of that doesn't feel that patients that are justly harmed by medical negligence, patients that are truly harmed by medical negligence, don't deserve just compensation. I mean, everybody agrees with that.
Right.
The problem is that the system has just gone completely amok. I mean, the United States Department of Health and Human Services in July of 2002 published a report on reforming the medical liability system. And some of the statistics are amazing. I mean, you've got a system where, you say trying to help patients, but less than 2% of patients in this report, they're actually harmed by medical negligence ever file a claim.
Is that right?
And they also report that in patients that file claims that actually go before a jury trial, in one study, less than 2% of those, in those cases, were the physicians actually found guilty. So, I mean, you've got a system that's wrong 80 to 90% of the time. So, I mean, when you've also got a system that, of all the money, the huge amounts of money that go into paying for medical liability insurance, only 27% of that money actually goes to the patients. 57% goes directly to attorneys, and the other, the additional amount goes to administrative costs. So surely there's room to improve a system that's wrong 80% of the time, and where patients only get 27% of the dollars that are actually allocated for them.
Wow. If a viewer wanted to learn more about that, I mean, this is obviously something you're very familiar with, John. I don't even think I was fully aware that you were this familiar with it. There's so many things I want to cover, and the excitement. A couple months back, we were at the Myrtle Beach Herald office at Myrtle Square Mall. We were visiting with John Charles, who I believe was also working in the emergency room, whose father-in-law has been a guest on the show a number of times, and learned from him a little bit about some of the practices that are going on within the hospital in his new position. And I think he was the one who made the comment, you need to get John Molnar in sometimes. He really knows the medical profession. He thinks it through. And recently, I think you served on the governor's task force for, is it health reform? Or?
It was the governor's healthcare task force.
Okay.
That was last year when Governor Sanford first took office.
What was that about?
He had, when the governor first took office, he assigned a number of individuals to a number of different task forces. Our mission was really to come up with ideas to give some direction for reforming the Medicaid and healthcare system to try to control the spiraling costs while improving the care to the physicians, to the patients that needed it most.
Mm-hmm. So, what's happened with that? Is that still going on, the task force?
No. We completed the work after about 2 months and published a report that can be accessed through the governor's website.
Right, good. Now, if a viewer wanted to learn more about medical liability reform, what would be the best way? Are there certain websites or phone numbers that a viewer could visit? Anything in particular easy to learn about if there's something that we may not be covering?
There's an actual real good website that just went up recently that was sponsored by Doctors for Medical Liability Reform, and it's protectpatientsnow.org. Protectpatientsnow.org. And so the real focus is on patients. Oh, absolutely. I mean, there's no question that the focus is on patients. I mean, I can give you story after story of things that are going on around the state. I just talked to a guy 2 days ago that works worked in an area in the upstate in Marlborough County that in one night had 4 patients, a tractor-trailer truck that collided with a pickup truck, badly injured trauma patients, followed by a gunshot wound, followed by a stabbing. And he had to ship them all great distances across the state in order to obtain the care they needed because he did not have a general surgeon available and did not have an orthopedic surgeon available.
When you say they're not available, you mean
there was nobody on call for that emergency department to fill those slots. So if a patient comes in that needs those services now, they have to be transferred. Patients that could formerly obtain the care that they needed in their own communities are now having to travel great distances, and oftentimes there's just not time to travel a great distance.
I think I saw the other day that it could be related or not. There was in Oconee County, I think in the upstate of South Carolina, there was at one time, even last year, I think there were 11 obstetricians who would perform births, wherein now, I don't know what the reason, but there's now just 4 obstetricians performing births. What do you think?
You're seeing that all over, and if things don't improve, we may be seeing that in this area. I mean, it's a real serious problem. The obstetrician's insurance, I talked to one of the guys on our staff, and he said his insurance since 2001 had gone from $14,000 a year to $48,000 a year. None of their other reimbursements gone up, and they continue to, for their employees, they've given them 3% cost of living increases and whatnot. A.J. Villani, a great guy, just a super guy here in town, was practicing up until last year. He had gone part-time, and he said he would continue to practice as long as he can afford it. And what happened with the price of the premiums have just gone so high now that he practiced until he broke even. He said, but he couldn't afford to lose money in practice.
Wow.
So it's a horrible problem.
And of course, the old thought was the creme de la creme, those doctors, attorneys, oftentimes these guys are the ones who. And you're spending 4 years not only after college, 4 years in medical school, then oftentimes 4 to 6 to 8 years in the specialty. How are you all? I mean, trying to cover the cost just to paying off your medical school loans. I don't know how you.
Well, I mean, cost is an issue, and I mean, I don't think anybody's going to shed a tear over the average physician's income. There's no question that they're going down, but the real issue is patience. I mean, the same thing under the same vein of the obstetric problem. A family practitioner in one of the rural areas outside of Florence was trying to give prenatal care to the indigent patients, the poor patients that really couldn't afford it. And so what he was going to do was try to provide prenatal care up until about the 7th month and then send the patients to an obstetrician for the actual deliveries.
Wow.
And in fact, what happened was he had to stop doing that because as soon as he made the decision to actually provide prenatal care, the price of his medical malpractice insurance went up $28,000.
No.
So that harms all those patients that now won't get that prenatal care.
Now, what's the flip side of this, John? What are some of the other thoughts? I mean, why would this still be in play? I mean, why has this not been reformed? Now, there are some states that have gone through some levels of reform. There's 5 or 6 states around the country that have really enacted something. There's surely some issues. This has got to be affecting state legislators all over.
It's a pretty big issue, and I mean, the United States Department of Health and Human Services, actually published this report. I mean, the president was pushing for it. The House of Representatives passed it. It is moving forward in a lot of states. I mean, because the fact is it works. The micro bill, the Medical Injury Compensation Reform Act from California that was passed in 1975 proves that fact. I mean, in Pennsylvania, where they had no tort reform, this is an amazing statistic. In the city of Philadelphia in 1998, there were more claims paid out for medical malpractice than in the entire state of California. Now, where do you think doctors are going to be more, likely to relocate?
Head to California.
I mean, physicians are moving out of Philadelphia, and they're moving out of the state of Pennsylvania like crazy. It's held up to some degree. I think there's a lack of understanding. I mean, I think people think that it is all about money and it's not about patient care or access to quality health care. And that's just not the case anymore. It's clearly about those things. And so I think, education is a huge role. But yet, you do have politics that play a role. There's currently a bill in the South Carolina legislature, and, that bill moved very quickly out of the House. the bill was first assigned to the House Judiciary Committee, and almost didn't get out of the House Judiciary Committee because the House Judiciary Committee has a huge majority of lawyers. I want to thank Alan Clemens, our state representative from here in town, who sits on the Judiciary Committee, who is actually a lawyer, who was very helpful in trying to move that out. The problem is that the bill came out very weak, and the hope was that when it got to the floor of the House, it would be able to be amended and have some teeth put into it so that it actually had some meaning. Unfortunately, the Speaker of the House declared that there would be no debate and that the bill would move on to the Senate. So now it's in the lap of the Senate in a fairly weakened form, and it's going to be very important for people to get a hold of their senators and let them know that this bill needs to be strengthened.
That'll be very important. That'll be very important. Now, there was an attorney, and it wasn't Alan Clemens, but an attorney who said really the focus should be on getting rid of incompetent physicians and working to focus on improving health care as opposed to actually making all these efforts to reform, because their perspective is that you're really taking away the opportunity, and you point out just compensation, but taking away the opportunity for, is it above and beyond? Well, there are some payouts that are really causing the problem, which are, what those are called, John.
Well, what we're interested in is capping the non-economic damages. Nobody disputes the fact that anybody that's harmed by medical negligence should get all their medical bills paid for. They should be covered for, any lost time from work, anything like that, even if it's for the rest of their life. I mean, somebody that has a serious injury due to medical negligence still, under this legislation, has the ability to recover millions and millions of dollars. What they're talking about is capping the non-economic damages, the things that you can't put a price on. And it's not that necessarily that there aren't even some patients that may deserve that. The issue is that just like in the emergency department, we're forced every day to make decisions in allocating our time to who in the department has to get the most amount of time. The legislature is going to have to, they're going to be forced to allocate resources. And the reality is you can't continue to have a system that punishes everybody so that a few people could get a lottery type settlement. And that's what's taking place right now.
That is exactly what's taking place. Wow. How about for you, John? I mean, do you all do everything through Carolina Health Specialists, or does each individual doctor have to pay a premium based off of their practice?
We have to. It comes directly, off the bottom line. Each physician pays a premium. Our premiums since the year 2000 have gone up about 500%.
Oh, come on.
500%. Well, in 2000 we paid about $3,000 a year for our medical liability insurance. And this year it's about $15,000 a year. And it's expected to go up another 30%.
And this is within and of course you all are making these dramatic, rapid decisions within the emergency room. I mean, you all are the most faced. This has had a big impact on you and your ability to make quick decisions.
It's a huge impact, and it affects not just the patient involved, but it affects every patient in the department. Because if somebody comes in, and if we don't have the specialist that's available to make that decision, and we're pretty fortunate here on the Grand Strand, it hasn't impacted us quite as hard yet. We've got the problem with neurosurgery. We've gone from having neurosurgical coverage 365 days a year to having neurosurgical coverage 10 days a month. So 20 days a month now we're uncovered. But the real impact comes when, you get a patient that comes in, for instance, an elderly patient with a intracranial hemorrhage due to hypertension, and you have to pick up the telephone and arrange for that transfer. You call the Medical University of South Carolina, and they pick up the phone and they say, "Yeah, send them." And then, 20 minutes later, they call back and say, "Hey, we're sorry, but we're out of beds." And then you get back on the telephone and you try to find somebody else, and you try to arrange transport, and you call a helicopter, and then the helicopter can't come because the weather's bad. And all this time that you're spending on the telephone while this patient and their family are agonizing over the fact that something that really needs immediate care isn't being taken care of. And all this time that you're spending is being taken away from other patients in the department. And, fortunately, we've been able to increase staffing at this point to make up for that. So we haven't seen significant effects in our department at this point in time of patients, really suffering from that, other than the patients that aren't getting the coverage that they need, the patient that needs the neurosurgical coverage. But they're seeing it all around the state. I mean, the physician I referred to, up in Marlborough County, they're seeing it in Richland County. They're seeing it everywhere. And the effect is that the few places that are continuing to provide these services are being overwhelmed. So hence why MUSC didn't have the bed availability to, accept a patient that needed care.
John, again, if a viewer, we just got a minute, if a viewer wanted to learn more about this, if they couldn't go online, protectpatientsnow.org, I think it was, is there a phone number? Would they be able to call, for instance, your hospital or give you a ring? Of course, we've got viewers throughout the PD in southeastern North Carolina. Would there be a way for them to learn a little bit about it?
I'd be happy to talk to people.
Right.
Time
permitting,
available,
sure.
time permitting. They can call the South Carolina Medical Association.
Okay.
Going online is a very efficient way to do it.
Of course.
But there are a number of different websites as well. ATRA, I think that just the real thing is just education.
Right.
Trying to find out about this. Talk to your doctor. I mean, most people have a doctor, and talk to your doctor. Find out how is this affecting him. Will it be affecting you? And I think the answer is that you got to really be enlightened.
John, you've got a daughter, and you've been able to educate her, talk to her about this. Is it gotten her interested in maybe steering away from the medical practice, or even thinking about it? Is this concerned her?
Well, my little girl's 9.
I'm sorry.
She does, but it is something that she hears about a lot because she knows that Daddy was gone to go to Columbia to find out about that. There was just a big rally at the State House on Tuesday, where physicians packed the State House to try to let the legislators know about the importance of this. So she gets those explanations while I'm gone. In fact, last night she knew that I was going to be on here, so she wanted to be you.
Great.
So she was walking around with the microphone, saying,
I love
Dr. Daddy, what do you think about that?
Oh, yes, that's fantastic. It's just as simple as that. Just like John's daughter, take that time to talk to your doctor. Whether he or she's been in practice a long time, they're familiar with the issue, and it's just their views as to how it can affect you as a patient. Take the time to spend a little time with them and ask them how it affects you. John, thanks so much for being with us this morning.
Thank you.
Absolutely.
Very much.
Stay tuned to more Carolina People coming up next. We want to thank Dr. John Molnar for spending a little time with us this morning to give us a feel of what it's like in the medical practice these days. You heard him say it. He was very clear. Talk to your doctor, whoever he or she is, about what's going on in their lives and how their practice affects you as a patient.